Hi, my name is Dr. Zainab and I'm a GP, and I just want to talk about another common condition that walks through my door, and that is back pain. Now, back pain, especially low back pain, is very common, and the most common cause is a pulled muscle. And how long that pain lasts for really depends on, number one, what caused the pain, number two, how you treat it when it happens. The worst thing you can do for a pulled muscle low back pain is to rest. Exercise, moving around, getting on with your activities is the best advice I can give you for low back pain. And some people like taking painkillers like paracetamol, ibuprofen, and other things like cocodamol. But I would suggest that if you can cope without painkillers, that's better. If you do end up taking ibuprofen, for example, make sure you take it with a stomach protector like lansoprazole or omeprazole. And things like cocodamol can become addictive, so it's really important to limit that kind of use of that kind of medication. So back pain can sometimes last a few days, or it could be a few weeks. It depends on what caused the back pain in the first place. And the causes are varied. The most common cause is a pulled muscle, like I mentioned. Very rarely are the back pains that come into my practice caused by infection, cancer, or a fracture. And then depending on the cause that I'm thinking, I will then organise investigations for the patient. Now, I really want to talk about the red flags when it comes to back pain and what would be seen as more serious. And this video might go longer than you like, but the red flags are so important to know. So please hang on. And you will find that if you go to your GP or see another healthcare professional about back pain, they will ask you these questions. So we usually ask if you've had any bowel, so your stools, or urinary, like your waterworks, that they're not functioning properly. Especially, for example, if someone comes in and says they can't pass urine, they're not able to pass urine, or they're having frequent accidents, for example, with their bowel or urine. If a patient says that they're unable to feel themselves when they're wiping their bottom, for example, something called saddle anesthesia, that is a red flag. If you're finding that your legs are becoming more and more weak, because obviously the nerves that come out the lower back supply the legs, and if there's any disruption in that from the back pain, then it can affect how your legs feel. If the symptoms of the pain are in both legs and the pain is excruciating, if the pain is worse at night, that can be a red flag too. If you're finding it difficult to walk recently and your walk is very painful. Another red flag is trauma. So I have had patients who've fallen down the stairs, for example, and they've had relentless back pain, and it turns out to be a fracture, which is a red flag. We usually feel that a new back pain over the age of 50 or a new back pain under the age of 18 is a red flag. So these patients need investigating. Other red flags are if there is a history of cancer within yourself and if there's been any further weight loss. You may also be asked if you've had a fever with the back pain, because you can get infections of the discs in your spine as well. But there are also other infectious diseases like HIV, tuberculosis, which can cause issues in your back as well. I tried to make this video as short as possible to try and just quickly tell you the red flags that I think of and I ask about in my clinic. If you have any of these symptoms, you should see your GP or a healthcare professional to talk through them. Obviously, if there's any red flags, you may be sent to hospital urgently for an urgent MRI scan. But like I said, the most common cause of back pain is a pulled muscle and is likely to get better over time. So in that situation, keep moving. Don't stop, don't lie in bed, because that's the worst thing you can do, and hopefully it will get better. Thank you so much for listening to the video, and I hope you have a nice day and see you on the next video. Thank you.